Lesson 22, Medical and Dental English. Today's lesson is an overview of vocabulary used in medicine and dentistry. Even if you don't work in these areas, you'll learn many useful words for talking about health problems and treatments in English. Let's start with the people who work in the medical profession. We have doctors who identify medical problems and recommend treatment, and nurses who help care for the patients. A doctor who specializes in a particular area is called a specialist. Here are a few common types of specialists. Surgeons perform surgery or operations. Pediatricians specialize in working with babies and children. Cardiologists specialize in heart conditions. Dermatologists specialize in skin conditions. Psychiatrists specialize in mental health. Orthopedists specialize in the skeletal and muscular systems. Oncologists specialize in treating cancer. And gynecologists specialize in the health of the female reproductive system. For a more complete list of specialists, visit this link. Routine checkups. Everyone should go to the doctor regularly for a routine checkup or physical. This is a general examination usually done once per year to monitor your health and make sure you don't have any problems. Checkups or physicals are a form of preventative care, things you do to prevent health problems before they start. At the checkup, the doctor usually measures your height, how tall you are in feet and inches or meters, and weight, how heavy you are in pounds or kilograms. He also listens to your heart and lungs with a piece of equipment called a stethoscope. He will probably put the stethoscope on your chest and tell you to take a deep breath. That means inhale a lot of air. He checks your blood pressure. If your blood pressure is too high, that is called hypertension, and it can lead to heart attacks and strokes, among other serious medical conditions. The doctor may also take a blood sample and/or a urine sample. The doctor sends these to the laboratory or lab for testing to check for potential problems. The doctor will also ask you general health questions. For example, how have you been feeling in general? If everything is okay, you can respond with, "Fine, no complaints." If you've been feeling under the weather, a little bit sick, then it's important to tell the doctor. For example, "I've been having frequent headaches lately." "I've been feeling nauseous after eating." "My back has been hurting." Health problems and treatments. The other reason to go to the doctor is if you have a health problem like an illness, you are sick, or an injury, you hurt yourself in an accident. One way to help prevent illness is to get immunizations or vaccinations, medicines that protect you from specific diseases. Unfortunately, not every disease has a vaccination available, so everybody gets sick from time to time. The doctor will ask you to describe your symptoms. Symptoms are the physical signals of the health problem that you are experiencing. Here are a few ways you can respond. I have a fever. A fever is an elevated body temperature. I have a cough. A cough is this. I have a sore throat. I have a runny nose. That means your nose is dripping liquid. I have a stuffy nose. That's the opposite of a runny nose. A stuffy nose is when your nose is blocked and you have difficulty breathing. I have a headache. I have a stomach ache. I have diarrhea. I have a rash. A rash is an unusual colored area on your skin. I'm constipated. When your digestion is blocked and you have difficulty going to the bathroom. I'm having trouble sleeping, or I'm having trouble breathing. Having trouble is another way to say having difficulty. I'm feeling unusually tired. I'm feeling lightheaded. Lightheaded means you feel like you might lose consciousness. Telling the doctor about your symptoms will help him make a diagnosis. That means identify your health problem specifically. If you want, you can also get a second opinion. Consult a different doctor. To treat you, the doctor might give you a shot, that's an injection, or give you a prescription, that's official permission to buy certain medicines. For antibiotics, which are used to treat bacterial infections, or painkillers, which are used to reduce pain. Hopefully, your medicine won't have any side effects. Side effects are unpleasant additional effects, like making you feel tired or making you lose your appetite. If there's a chance you might have cancer, the doctor will perform a biopsy. That means removing a small sample of the potentially cancerous cells or tissue for analysis in the lab. If the test shows that it is benign, that means it is not cancer and will not spread to other parts of your body. If the test shows that it is malignant, that means it is cancer and can spread to other parts of your body. The treatments for cancer include surgery to remove the cancer, chemotherapy, that's treatment with a combination of powerful drugs, or radiation therapy to damage and kill the cancerous cells. These treatments are often expensive, so hopefully you have health insurance. That's a plan you pay every month that covers the costs of expensive medical treatments. Now let's talk about injuries, when you hurt yourself in an accident. Common types of injuries include cuts, when something sharp breaks open your skin and you start to bleed. If the cut is serious, you may need to get stitches. Burns, injuries from fire or hot objects. The treatment involves applying a special ointment, cream, and a bandage to cover the damaged skin and protect it from infection. Sprains or strains are injuries to your tendons and ligaments, the connections between your muscles and bones. Sprains and strains usually heal in several weeks with rest. The doctor may also give you a brace to help support that part of the body until it gets better. Broken bones or fractures. When you break your arm, leg, or another part of your skeleton. Depending on the fracture, the doctor may need to set the fracture. That means put the broken parts of the bone into alignment. Then you'll get a cast, a hard, protective covering of plaster that keeps the broken bones immobile until they heal. If the injury was to your foot or leg, you'll need to walk with the help of crutches or a wheelchair. Finally, you may need physical therapy, special exercises to help recover normal function of your body. Going to the dentist. We'll finish up our study with a trip to the dentist. It's important to visit frequently for a cleaning of your teeth, which is usually done by the dentist's assistant, who is called a dental hygienist. The cleaning removes plaque. Plaque is a light yellow covering of bacteria that forms naturally on teeth. If left untreated, plaque can lead to inflammation, that's irritation, of the gums, the pink part around your teeth, as well as cavities, holes in the teeth. If you have a cavity, the dentist will first do some X-rays to see the extent of the damage. Then she will give you local anesthesia, an injection that makes that area of your mouth numb, meaning you can't feel anything. She then removes the damaged area of the tooth and inserts a filling, which can be made of gold, silver, ceramics, or a synthetic material. If the tooth is badly decayed, then it might be necessary to perform a root canal, when the nerves and blood vessels inside a tooth are completely removed, filled with an artificial material, and the top of the tooth is protected with a crown. Finally, if a tooth is very seriously damaged, it can be extracted, removed. Dentists can also repair chipped teeth when you hit your tooth and break off a small piece, and perform cosmetic procedures such as whitening. If your teeth are crooked, out of alignment, then your dentist can refer you to a specialist called an orthodontist, who can give you braces. Braces are equipment that changes the position of your teeth over time. Finally, let's learn the names for different types of teeth. Incisors are the teeth in the front of your mouth. You use these for biting your food. Canines are the sharp, pointy teeth next to the incisors. Molars are the big teeth in the back of your mouth. You use these for chewing your food. Wisdom teeth are the final set of molars, which usually appear between the ages of 17 and 25. They often grow in the wrong position and need to be extracted. Children's teeth, which are temporary, are called baby teeth. They eventually fall out and are replaced by permanent teeth. You've finished Lesson 22. If you're interested in reading and listening to more articles with medical English terms, go to manythings.org/VOA/medical. This lesson was rather long, so there's no quiz today, but log in tomorrow for Lesson 23, Legal English.